What's going on, YouTube Nation? We have the HOP patient ready to be served, so let's serve him with a smile. Let's not waste any time. We have our equipment. We have our sharps container. We have our heat pack, just in case if we need it for a small vein, because the heat's going to expand while the cold's going to shrink. Then we also have our 5cc syringe that we can either use a 23 gauge needle if it's a normal size, regular size vein, or if it's a small size thin vein, we can use a 25 gauge needle. We also have a cotton ball to press down on the sites, alcohol pad to clean the sites, a transfer device as well. Before we do anything phlebotomy, we always have to identify the correct patient, because identifying the wrong patient is the #1 mistake phlebotomists make, leading to errors in lab diagnosis and delayed treatment meant for the correct patient. We have a bracelet around the patient's wrist, a Q patient identifier to ensure that there's no mistake of drawing the wrong patient. We have a last name, first, and date of birth. Sir, is your name Herbie McGee? Date of birth 3/15/75?
Yes.
Excellent. We are now going to get started. The MD will bring his lab order soon. Nurse's station's too loud. Let's close the door. Now when you apply the tourniquet, you're going to apply the tourniquet 2 times. 1 time to find the vein. Once you find the chosen vein, use a needle that fits that chosen vein. Whether using a straight needle or a butterfly, depending on the size. Use your best judgment. Take your time finding the vein. So this is going to be our first attempt. We're going to apply it tight. Hold that tension. Excellent. Find a great superficial vein. A vein that's going to be up to the surface. And it looks like we have many options. You can always press, you can always flip. Whatever it is you want to do to get the vein noticeable and irritate it so that the small vein could get bigger, that's what you can do. Also use an alcohol pad. Once you start rubbing it up against the skin, it will enlarge. So that's a good tip for you. But if you have a good vein, this is a good vein right here. This is an excellent size vein. Oh, it looks like the doc is already in with his order. Alright, no problem, doc. We'll take care of that ASAP. Perfect timing. Okay, so now that we have our vein, we're now going to release the tourniquet, the first of 2 attempts. So now that I found a vein that's a good size, it's going to be deep, because once I press down, it feels deep, not to the surface. Insert the bevel deeper when ready to poke. Even if you go through, you can always pull back just a bit. Pull back on the plunger, and if it starts flowing like a river, you're inside the vein. But if you start struggling, you're not inside the vein, that's when you have to start pulling back and start redirecting. We get our 5cc syringe and a 23 gauge needle with it on like this. I like to pull my cotton ball and get the paper tape ready on my glove. Slap it on just like that so it's easy access. Okay? So now this is going to be our second and final use. Hold it, keeping that tension. Perfect, just like that. Okay, we're going to do the same thing. Keep repeating the same process. Keep pressing on and irritate those veins. Feel free to slap it, flick it, whatever it is you want to do. Veins need to be engorged. And once it's nice and engorged, the patient can either make a fist or do it just as is. Making a fist prevents the vein from moving back and forth. Open our alcohol pad. 5 cc syringe, always make sure to release the air. Wipe the skin clean. We're going to wipe our finger. If we have to touch, we're going to touch above the site, not on it. Feel above the punctured site, just like that. You're going to poke. Once the needle is in, you're going to see a little flash of blood. You will see it flowing now. We're inside the vein. Pull back on the plunger. Keep pulling. Now, as you can see, our right index is up against the skin. Pressing on it, making sure the needle does not go further in. I'm pulling back on the plunger slowly, and it's still smooth. It's coming out very smooth. No resistance from the syringe. The needle is steady and not moving. In fact, all 3 of my fingers are pressing up against the patient's hand. I have stability of the needle. I have stability of the patient's hand. So once we are all finished, pull out. Get your cotton ball, put it over. Take the needle straight out. Activate the safety shield. Release the tourniquet. Have the patient press on the cotton ball firm for 30 seconds. If the patient is on aspirin, for 1 minute. Start inverting the syringe. In the meanwhile, you have your patient put pressure while you start writing info on the blood sample. We need to start transferring the blood into the tube. Some patients may take longer to stop bleeding. No patient wants a bruise. Those are going to be our tubes. Senior patients may take aspirin, hence the long duration of putting pressure, and as soon as the patient stops bleeding, perfect. Go ahead and slap it over. Always make sure to apply paper tape and no band-aids. Band-aids are too sticky. Great. Twist off the needle. Put in the sharps. Attach our transfer device. We have 5 cc's of blood. That's fine because it's blue top. We're going to fill it to this line, which is going to be 1.8 mLs of blood. Now transfer. And that looks like it's to the line. 2 more tubes, but we don't have to fill them up. Gold is next. The CBC only takes about 1 ml of blood, so we can go ahead and place our finger above the 1 ml. So we can make sure that the rest goes into the lavender. That's excellent. And then the rest. Perfect. All 3 vials are good. We'll go ahead and discard it in the sharps container. The syringe as well. It's big enough. Continue to invert it a few more times. Start writing your initials, the time you drew, and the dates. And you're done. And that's all she wrote. Thanks for watching. Click on the next video to keep learning phlebotomy.